we're talking about the flu shot. And if you're not going to take the flu shot, well, what should you do? Well, why not take the flu shot? I mean, it's simple. The pharmacy has them for $15 or $20. Why not just get it done? Well, I've been in practice for almost 30 years. People get the flu shot and frequently they get sick from it. I don't care what the big, gigantic scientific studies show. I've seen people who get sick from the flu shot. If it's 1 in 100 or even 1 in 1,000, it's like, think about it. There's a possibility. It's not mother's milk. It's not the safest thing in the world to do, and just like drinking a glass of water. It's not like that. There are risks. In a flu shot, formaldehyde, mercury, aluminum, MSG, the CDC, Center for Disease Control, openly acknowledges they're parts of the flu shot. They use them as preservatives. It's fine. If you want to accept that risk, that's great. But nothing that's going to be a powerful agent is going to be without some risk. Flu shot, of course, qualifies for that. It blocks 2 forms of the flu out of 20 plus forms. So will it prevent you from having all flu? Absolutely not. Does it prevent other illnesses? No. In the people that it's supposed to help most, old people, young people, it doesn't seem to have a whole lot of effect. It's very careful about getting a flu shot. So what do you do to prevent the flu? It's really simple. In the winter, when people get flu a lot, vitamin D goes down. So what do you do about vitamin D? Take vitamin D3 at 5,000 to 10,000 units a day, or cod liver oil, a teaspoon or 2 a day. Ugh. But it's very helpful. There's lots of good stuff in that. Vitamin A also helps reduce your risk of viral infection. 10,000, 20,000 units a day. Always with these things, you got to get with your doctor or health professional who understands nutrition well. Vitamin C, of course, reduces your risk of infection. We don't need to have a whole lot of argument about it. It's totally safe. There's not a whole lot of downside. It builds your connective tissue. It reduces your risk of infection. It helps. Zinc, of course. So vitamin D, vitamin A, zinc, vitamin C, mushroom extracts, sleeping well. Don't stay up all night and roll out of bed at 4 in the morning and get to work at 6, and that's not good for you. Take good care of yourself during flu season. Stay warm. And if you're going to get the flu shot, make sure you haven't been sick for 2 or 3 days before it without a fever, and get with your doctor because we're better together.